You're watching Wellness Hour Live. I'm Randy Alvarez, and today's topic is how to thrive in this COVID economy. With us, we have an expert on this topic. He's been a consultant to dentists with rave reviews for more than 30 years. We've had him on the program before, and he's helped a lot of doctors that I've met and know, and everyone says great things about him. And he's going to share with you some of the new techniques, and I call it his COVID playbook. He's got a lot to say. He's written a lot of books. Dr. Marc Cooper, welcome to the program.
Thank you for having me. I'm looking forward to this conversation with you. I think it's critical that people hear, or at least look within themselves about what they're going to do into the future.
Okay, good. Now, for people that don't know a lot about you, you've written 11 books that have been published. You've 2,000 blogs. You've got 4 ebooks, 100 plus published articles. You're a busy guy.
Yeah, I find when I write that I can see more clearly into a future than when I just think about it. When I try to speak about it in written word, it gives me access to seeing things I couldn't see otherwise.
Okay, good.
So that's
good.
Right so much.
Now, I met you 10 plus years ago, and you grabbed my attention, and I think the statement was, you said, Randy, I could see the future. And you elaborated and explained what you meant. So you still feel like you could see the future, and the things you predicted back then, which I thought were kind of way out there, have all come to pass. Tell me about that. You still see yourself that way as a person that can see the future of dentistry?
The answer is yes. I don't know why I have this talent set. Some people can play piano brilliantly. I can't figure out how to do left and right hand. But for some reason, I have a capacity to see what's coming at us and the way it's coming at us in the area of dentistry and the dental industry.
Okay, good.
So I can see the trends, I can see the patterns and where they're going to end up. So I can see the dots going outward and see where that future is, and then look from that future backward.
Now, for people that don't know your consulting business, who's your typical client, your typical dental client?
It changed in the last 4 weeks.
Okay.
Okay, so whatever we talk about could be outdated within 3 to 6 weeks. Things are changing that fast. So what I did, first, I have to give a little background. I think my tribe is dentists. They're dentists. I've been a dentist forever. I have worked with them for a very long time. And I feel like I'm an elder in the tribe. So I think I need to contribute back into it. And what I see is this future and the inability of the dentists to operate successfully in this new ecosystem that's emerging. They're doing what they always do, trying to solve it technically, and that's not going to get them there. Everyone knows about filters, and we'll talk about that, and about the booties, and about the PPE, and all that stuff that's going on. But ultimately, it's going to be who they are as a leader that can take their team through these changes that they need to go through. And very few people are attending to that whole arena.
Okay, now you're involved, I guess you work as a consultant, helping dentists build group practices. The second thing, which is big, is it's not a mastermind, you call it a beginner mind. What is that all about?
So what I noticed, so number one, I did build group practices, but that's not my focus in the last month. It's about who I'm working with. They could have 75 practices, they could have 1. The same principles are going to be involved. We're not talking about the business side as much as they're working on the mechanical side. But I'm working on you're a patient. What kind of office do you want to walk into? What kind of dental office do you want to walk into?
A place that I guess is very safe and clean.
Yeah, okay.
And somebody that I kind of connect with and trust.
Exactly. So when I go out and I started talking to people, you asked me about, well, who are my clients? My clients currently are people who reject a return to normal. It's not going to happen. Normal is not going to be what I'm practicing into. people who know that what they've got in terms of the way their structures are and their assets are allocated are not going to succeed in the new future. And third, they have to realize that they have to become a different kind of leader to move their entity into that future. So I'm looking for people that are like that say, oh, you know what, I better figure that out. I can't wait for it to go back to. They're rejecting normal. So there's some classic features of the clients I'm working with now.
So tell me about this beginners group. It's like a mastermind, but even better. Tell me why.
Okay. First of all, if you look at what a master is, you have to go from apprentice to journeyman to master. That means you've mastered something that's already been in existence. It's already there. Well, it's not already there in the future of the Corona-19 virus. We don't know what there is exactly. So you have to be able to innovate, to figure out as you go what you're going to do to what you just said to keep the feeling safe and secure, not only the patients, but how about the staff? How about the doctor, him or herself too, being safe, seeing all those patients? So you can't go in with any mastery because you've never been there before. So there's, I'm a little bit of Zen here. So this thing called the beginner mind, which is, I don't know anything. I have to figure this out. I don't know. Not, I already know and I'm going to tell you, I don't know. So I want the people that I work with to be open to having a beginner's mind. Redesigning and reinventing dental practice, it doesn't need to look like it did before.
So you are convinced dentistry will not return to the way it was after this coronavirus?
Yes. You said, can I see the future? Here's the future. It's not going to return to normal.
Are you going to share with us a few of these tips on things that they could take home and do right away?
I will.
Okay.
If you pay me enough.
Okay. So are you looking, because we talked a little bit on the phone, I said some people like to market in emergency when it's kind of too late. Some people are not going to be early adopters with this.
Right.
They need to innovate quickly. Is that your belief? Change their approach quickly?
I think there's first movers in anything that occurs in a new environment, in a new ecology. They'll have an advantage for a while. There are things that are going to have to be done in much larger groups in terms of leverage buying for like PPE and shields and all that stuff has to be worked out. But it's those who can create a practice where I am a patient, and I'll describe what you're asking.
Okay.
It's a little futuristic, but I'm in my car. I've done as much as I could in telemedicine. Everybody knows everything, my health history, my insurance, it's all down there. I'm waiting in my car. I get buzzed. I pick up the phone. It's the dental office calling me saying, we're ready for you. We are ready for you. So please take the elevator to the left, and you go to the elevator to the left, and there is the hand sanitizer, and it says, please use before entering the elevator. And then you go up to the third floor where the dental office is located. You walk down the hall, but there's no knob that you can turn to get into the office. So there's a buzzer that takes a picture of you, one of those things that you have outside of your house. And there's a hand sanitizer underneath and says, before you enter, please do this. If you're wearing gloves, please dispose of the gloves into this trash can or into this vessel, because the gloves could be carrying coronavirus. The door opens, and in there is someone in a modified suit with a mask and all of that. There is no chairs in the waiting room, or there's a few. There's no one in the waiting room. And this person does a pulsometer to see what your oxygen consumption is and takes your temperature and maybe does a few more vitals before that, and then goes through your health history to make sure you haven't traveled. And everybody knows that they're up to safety.
So the dental, so I'm following this correctly. So the new reception area could be the parking lot of you being inside of your own car, and then you will get buzzed in there. You'll get buzzed in, and this person you said at the front that they meet will have a bigger responsibility, almost like a nurse practitioner. You said.
Yes, exactly.
So tell me about that.
Yeah, or treatment coordinator from someone who's able to do a generate a level of confidence with the patient because of maturity, and has a capacity to have worked with people in a certain level of relationship and communication, who's able to do the protocol that is going to be installed. And we're doing a more dramatic view of what that protocol, but the protocol would be the same. There wouldn't be there's a door behind this person, and the door behind this person is only opened when the person pushes her button that things are clear. She doesn't have a temperature. We did the swab. Everything is good. The whole deal.
Yeah.
They open it up, and she personally escorts that patient, or the assistant does, to the operatory. And so they walk. There's no human interaction. The distancing is. People are going to get used to that. The future is, you know what? Can we do this by Zoom? I don't need to meet you for lunch. So we're going to be contracting in terms of our relational basis. And the less people, the safer I feel. So I want to reduce traffic in the whole area of my dental practice. I mean, that would make me feel safe. That means there'll be a staggered schedule. Patients can't be doing that at the same time, which means there's somewhat a reduction in revenue. So there's a whole thing that begins to emerge here about, well, what are people going to do when number one, there'll be fewer staff. Number two is they have to look at their margins differently. And they're going to have to figure out how to do dentistry in a whole different way. But when it gets into the operatory, except for how it's suited and how the HEPA filters are working that won't let through the viruses into the atmosphere and the negative whatever, and the whole deal. The whole deal feels different.
Are there practices that are doing this right now that you are consulting with?
They're on their way. They're on their way. So remember, they're rejecting a return to normal. So they realize that what they've got isn't going to work into the future. So now they have to design a practice in which the context has shifted. So what's primary is what you said. I want to feel safe. Two questions patients ask. Will I be safe? And do I trust this person to keep me safe? So the area of trust is also one of the areas that I'm working with my clients on, how to expand trust of the client to the practice. And this is a good time to do that because everybody's home.
So when you get in these groups and you limit it to 10 doctors per group, you are going to go over specific protocols on how to implement this and how to carry it out. Is that correct?
It's so great to say that. Everybody, you and I have been around a while, and you know that when one of these things happen, everyone has got an answer to buy. I don't have the answers to buy. This group actually goes out and figures out those things that need to be figured out. I facilitate the figuring out. There are incredible resources out there that know a lot more about HEPA filters and about UV lights and about things that diminish the spray or take away the spray than I'll ever know. What I know is how to get a group to do what it needs to do, is to innovate a future that is going to be successful in that future. I know how to do that.
Do you believe it's wrong thinking when I talk to a dentist and he says, I'm going to wait until they open up the bars and restaurants in a couple of months, and they're under the impression that they're just going to be a little cleaner, maybe have the girl at the front desk wearing a mask, things like that, but they're really not making big changes. They're actually going to be doing nothing, and then they're going to wait until it opens up. Is it too late in your view at that point?
My answer is yes. They'll catch up. They'll be late adapters. So it'll cost them a lot more to catch up. And they won't know it. When I copy something and try to make it mine, it isn't as good as when you originated yourself. So the people who start out as the early ones, as those people who work through all the mess to get to what really works, they're going to win.
You have principles that you share. Let's go over a few of those principles.
There's A couple that I honor. Everybody has whatever they choose as their principles. My first one is context is decisive. It's a principle that I believe in, and I think manifests the way I see you asked me how I see the future. Standing in these principles allows me to see something that is other people might not see.
So context is decisive, you said.
Yeah, exactly.
Okay.
So when was the last time you saw a payphone?
It's been a while.
Yeah. Well, what happened? The context shifted, and now you have a smartphone. And your whole life is different because of that smartphone. The context is decisive. The coronavirus is the context that we're in. There's no one on the street. The air is clear where you live. I mean, it's pretty remarkable what's occurring in terms of this contextual shift. Now, in fact, if they come up with a cure and it's over tomorrow, I might not be accurate in my prediction of the future. But my second principle is it's called the law of integrity, which means without integrity, nothing works. And I'm looking out there at the environment that we're in and looking at the governance that we're getting, and there's no integrity. This thing, from my viewpoint, is going to last a long time. This is not because we don't have integrity in the decision making. People with integrity give and keep their word. That's integrity.
Now,
I don't.
Mark, let me say this though. We all know, it seems like we've at least been told to have integrity in business. So going deeper into integrity, give me an example what you mean by that. Because we all know and we give lip service to integrity. Can you give me an example of this?
Oh, I can give you an example because it's one of our core values in my business. We honor ourselves as our word. That's integrity. We give our word. That's an oath, a promise, a vow. That's integrity. There's not much above us in terms of by the way, I did a global survey once when I was in the survey business. And I asked of a lot of dentists and other industries I was in, dentists had the highest level of integrity on that survey. Really, it made me fall back in love with dentistry. Like, these guys are really something special. They really care. They really want to do the best for their patients. Yeah, there's all the other mess around it, but really, they're really good people. So integrity for me is whole, complete, unbroken. And if you have that, the example that I use oftentimes is if I have a car that's a 6-cylinder and a cylinder goes out, the system doesn't have integrity. It doesn't work so well. And since we have no integrity that I see right now in terms of solving the problem, the length of time will be much longer than going back to normal by May 30th. I don't believe that will happen. And the last one is be responsible. And what I mean by responsible is, hey, you know what? The cavalry isn't coming, I can tell you. They are not coming. It's going to be up to you. You're going to have to make it happen. You're going to have to be cause in this matter of making your practice work. So those are the principles that I look from and who I look at. And that's how I come about seeing how I see the future in myself.
So there's going to be a new normal that these doctors, these progressive dentists, have to adapt to. Is that what you're saying? That you say it'll never completely go back to normal, so they have to completely reinvent themselves, reinvent their practice, reinvent their visions, all of those things? It's like starting with a clean slate. How are we going to operate post-COVID?
You could be in my seat interviewing me. I mean, it's like, exactly, precisely, that's what's going to occur. In my view. Now, I could be wrong.
I got to tell you, what I just said is based on our conversation yesterday. It gave me some ideas. And it actually enlarged my vision of what was possible with some of these doctors' offices. And you really, it's like Darwin said, those that had the ability to adapt to change survived. And,
right,
and
exactly.
That's kind of what you're teaching, these new survival skills, I guess.
Yes. In fact, I'm going to use that line in my marketing. Thank you, Randy. That was perfect. But it is a new survival skill. You can't use what got you here to get you there. You need new skill sets in leadership for sure. And if you can't do that, the team needs to feel safe. and the team needs to be able to deliver something that they haven't delivered before. The SOPs that these guys have in their offices will not be the same in the post-COVID environment. People will have different accountabilities. It will be different. It will be different. I don't know what else to say. It won't be the same as it has been.
Do you think the threat of corporate dentistry for the individual practitioner is now going to be a bigger threat than ever? Give us your stance on that.
Absolutely.
And what can you do about it?
Well, I don't hold corporate dentistry as the enemy.
Okay.
So I don't speak of it in the language that solo practitioners often do, as though they're Darth Vaders ready to take over the planet. I think many of the ones that I have worked with and the people that I know have high integrity, trying to do the best that they can. I think the dentist solo practitioners are going to be in real trouble over the next couple months. The longer this goes on, the harder it's going to be for them to sustain themselves. You've got student debt loan of $300,000. You just bought a practice for $1.2 million. You got this house and this mortgage, and you got your second child coming on the way, and you don't have patience, and you don't have cash flow, and you don't have revenue. So the asset value of any business is based on EBITDA, which really is about cash flow. You don't have a cash flow, you don't have a business. But he's got all these liabilities, or she's got all these liabilities. Those DSOs, those dental service organizations that have deep pockets and strong investors that can wait it out, will go looking at practices that are in deep survival, and they will make offers. So the negotiable value of those practices will be much less than 2019 production. It would be totally different. I won't say pennies on the dollar, but it will be greatly reduced.
So best practices, a big word they throw around a lot. There's going to be a new best practices for treating emergency patients, getting them through the system, in the door, out the door, following up with them. Are those things that collectively you will discuss in these groups of 10 that you...
They'll figure it out for their environment. The answer. So before you, I spoke to someone in the small town Midwest. Big difference between that and my client in San Francisco and what they have to do. It's just going to be regional at first. And because there is no answer that is solid and proven and evidence-based, and they're trying stuff out, you need a certain level of relationship and cohesion in the group to be able to talk about mistakes, and because that's the only way you learn. So I think that yes, the answer ultimately is there's dentists who are willing to jump off the cliff and build their wings on the way down are going to win this one.
Okay. Now, people refer to you as a lot of things: a coach, an innovator, a futurist. But you told me one of the things, like you look at yourself as an elder.
I do.
What do you mean?
Well, I am an honorary elder in a Native American tribe, and I have spent time with elders. Elders bring wisdom, and wisdom means not having the right answer, but doing the right thing at the right time. I'm able to apply 35, 40 years of experience into a knowledge that has transformed itself into, you don't make the same mistakes you made 10 years ago. You've learned. You've got wisdom about that particular arena. The wisdom that I've been able to accumulate as an elder is I've turned that into what I call, older to elder, or aging to saging. I see things as an elder looking at the whole of it rather than at the particular parts. So I have the ability to see a much larger landscape.
There's lots of coaches out there. What do your clients say about you, about why Dr. Marc Cooper, and how you might be different?
Well, they give me a nickname, and they call me Yoda.
Okay.
So, I bring something. First of all, the level of integrity that I bring to my word is very high. So they trust me. And when I screw it up, I clean it up. So they know that about me. And they know that I care. They know I'm committed. And they know I appreciate them.
Okay, good. Let's talk about this concept when you work with a doctor where you said you have them write a big circle or make a big circle.
All right. I just did this before our conversation. So every doctor I go, if number one is most of them have furloughed many employees. They have 2 or 3 left, their core team. So where most dentists are at is right there. Then I have a Zoom call or a Skype call, a Zoom call with them and their team. And what I do is I have them draw a large circle and then put hashtags around the circle for every patient contact. And that includes verbal, that includes electronic, and that includes in the office visit. And then I ask the question, how can you make a patient feel safer at every one of those hashtags?
Good.
How do you do that? And so they have to go into doing that process and talking about it and coming up with action steps with by whens and all that. But now they're looking at how do I enhance the feeling of safety for the patients? And we do the same thing for the staff. How do we do that so the staff feels safe? In terms of the circle, they do a staff circle and a patient circle. But then they kind of go, okay, we can do that.
So it's kind of fun.
So,
I guess the team and the doctor all come up with some great ideas of, every different point of contact to make it safer, better, etc.
Exactly. And then they own it. If I copy it, I rent it. If I create it for myself, I own it. So there's a whole different level of commitment towards it because they came up with it.
You say that priorities are going to shift with patients.
Yes.
Tell me about that.
Well, you're a patient. I just look from your own experience about what you're going to be looking for in a provider.
So it's not going to be just get me out of pain, clean my teeth, give me new veneers, dental implants. The priorities are going to change to what in this COVID environment, COVID-19?
You and I are pretty health conscious. So those patients that are very health conscious are going to look for a place that are going to keep them healthy.
Okay.
Keep them away from a virus. Keep them away from, do I trust this person to keep me safe? And do they have I walk into an office, as we just described in the beginning of this call, I feel, they're looking out for not only my safety, they're looking out for theirs. This is a safe office. So I say that becomes, in this new environment, a dominant feature is going to be, safety, security, and trust. And if you don't have that, it's not going to be functional. Take a look at an orthodontist. They're used to doing 60, 80 patients a day. What are they going to do?
Yeah. Wow. Interesting.
And Budo was the same way. Dentists have really immense problems they need to solve. But and this is where we could talk about an elder. An elder creates an environment where solution is more readily available because they can take excuse my French, they can take the bullshit out of the way and get down to the heart of the matter.
Do you think that all the extra safety precautions will be good for word of mouth for the doctor?
I think it will be hot for a while because it's going to be so different. I look at how the human being operates, and one thing that's more powerful sometimes than thought is experience. If I go in and have this feeling of being taken care of and security and safety and stability, and that they really check things out, and even the exit door is different than the entrance door, and all that. It's just, as soon as I get to anywhere on my WhatsApp or whatever the hell they've got, they're talking about it. The first mover position, it will be copied. If this works, what I'm speaking about, it's going to move the whole industry towards that.
Because the level of expectancy going into a dental office might be a little bit low of what to expect. So I guess when you exceed that, and everybody's looking for things to talk about at home, you're even looking for things to watch on television because you've seen every movie. And so now you're going, you're not going to believe what happened at the dental office. Is that what you think is going to happen? There'll be buzz?
I think there'll be buzz, but I think it will also be preceded by a different level of communication with the patient. So I'm recommending to my current clients that they get on the phone and ask how people are. You know, what's going on in your family? What are you doing here? What, are you having any problems? Is there anything I can help you with? When I talked about cohesion as one of the principles that people need to follow here is bring people closer together. Your patients are your biggest asset.
Okay.
If you're not taking care of an asset, it turns into a liability. What are you doing today?
So,
today.
So if you have 5,000 patients that are in your system,
right.
The new recall approach might be to call and just say, how's it going? And by the way, here's some at-home things you could be doing to keep your mouth clean. Is that what how you're envisioning this?
I don't even know if I go into oral hygiene, but that's a great idea. I would actually add that. I think that's brilliant. Yeah, see, that's innovation. And I think that's what you need to do to get into this new future is innovate, not go with the past. Yeah, call but you've got 5 staff that are furloughed. They've got time. It says in their furlough that they're going to come back to work when you're ready to have them call some patients. It's not, you don't have to pay them per hour. Now you're going to get me started on this whole thing. But if I have a staff and I say, listen, we need to stay in communication with our patients. They are our lifeblood. They are the heart of the matter. They're why we're here. And, this is out of the goodness of our heart, not out of my wallet. And people don't want to do it. It tells me something about that staff member and about the relationship they have to the whole thing we're trying to create. We're reinventing dental practice. A dental practice that isn't mechanical, that really cares, is also something they'll talk about at home because the trust factor is so high. And remember what I said in the beginning, do I trust this person to keep me safe is a cardinal thing that people are going to be walking around with.
Back to the recall one more time. So rather than just calling and saying, hey, you're due for a 6-month cleaning, you're saying call and ask more questions about their family and their overall health and maybe things that they could do at home. Could you give me maybe a little bit of a script or an example?
I could give you an example. So my physician calls me up because of my age and he says, you're quarantined. You can't go anywhere. This is before my governor said so. So I'm quarantined. And then about an hour later, my hairdresser calls me. Her name is Tracy. And she says, I don't know how she found me. She says, I heard you in quarantine. Is there anything I can do for you? So does you or your wife need anything? Do you want me to go grocery shopping or walk your dog?
Wow.
And exactly. I am handing out, if anybody wants to get their haircut, better go see Tracy now.
Okay.
Because it was such remarkable caring for me. The building trust is what needs to close in this environment because people have lost trust. And we've lost trust. We've lost trust in our executives. We've lost trust in what people say. We've lost trust. So we need to fill that vacuum. And how do you do that is by caring. But you have to be authentic about it. It can't be a script. You have to really care about people at that level. And then I love your idea about, talking about, handling the infection and having them be more healthy. I think I won't make a course out of it, but I think.
Because we're short on time, what is the future for dentistry like right away? Because you say it's going to change into almost like a primary care. What do you mean by that?
So there's the health system is going to come under examination and change because of the COVID. It's just like dentistry is going to change, the whole healthcare system will change. When I walk into a dental office and in the future, I'm going to have some vitals taken that will go to the electronic patient record so that I'm integrated into more of the primary care role. I work with a company called, I spend time with, they never pay me money. So I spend time with a group called Kaiser Permanente.
Okay.
And they have a dental group and they call it the Permanente Dental Association. It's about 106 practices and it's part of their insurance plan for lots of people. Dentists are on salary. They don't get paid by production. Not only that, is that they get paid if they close the care gap. If they reduce the infection in a diabetic, he'll need less care.
Okay.
If he needs less care, he'll cost less to the system. And that's how dentists are incentivized, is to close the care gap. And so they have physicians and they have dentists in one office. And they work in unison to reduce the care gap, and they're paid the same way. So I think it's going there because the health system, it needs to be more integrated to be more effective.
You also say that there's going to be no more hierarchy in dentistry. What do you mean by that?
I mean, on the local level, when we take a look at leadership has always been in dentistry top down. There's a couple companies that have moved it out to healthy partnerships, but I think to generate the innovations and to execute the innovations that you need to execute, the team needs to be extraordinarily unified. It needs to be a whole, a unified whole. So it's not top down. The leader has to go bottom up. They can't tell people what to do. People need to generate the solution as a unit, because then they'll all be committed to that solution. It can't be told, it can't be declared, it can't be ordered. So that's what I see the hierarchy being diminished in terms of top down. It has to go bottom up.
Okay, now I know, look, this is a big topic. We could talk to you for hours on end. I mean, you've written, is it 11 books?
Enough.
You've written a lot of books on these topics. But final message about this beginning mind group, this group of 10 doctors get together, 10. You're in groups of 10 that you work with. How does somebody get involved? Where do they go to find out more about it? And what's the time commitment like?
Given the way I design my work, it's up to them. So I don't have to spoon feed anybody. If they can't get it done themselves, then it's not going to work anyway. So I don't give them much. I think what I do is have two Zoom phone calls a month. Okay. And then they have assignments in groups, and they go out and they do what they need to do. And someone takes on air filters, and someone takes on, calling people in the safety environment from hospitals or from, all that. So they have to figure stuff out that's going to work, and then bring their assignments to the next call and then move them forward. So I guide people, but I don't tell people. So that's what I'm doing. So these groups.
Are your goals to keep those 10 dentists in that same county, 10 dentists across the country? How are you dividing it up?
I rather than be regional, so they're on the same time zone. Setting a Zoom call with 3 different time zones, as you're well aware, is much more difficult. And they ought to be friends with each other, maybe from the same study club, maybe from, they just hung out together. Like is like, the people that I have worked with know that what I'm looking for is what I said. They need to understand that there's no going back to normal. They need to believe that the future is going to be different than the past. And whatever we did in the past may not work in the future. They need to be entrepreneurial to some degree to be able to put their minds together to figure stuff out and then apply it individually to their practices, because it will be reshaped by how their practices are done. There's not going to be one answer to all of this.
So it is closed-minded for a dentist to say, Randy, when the bars and restaurants open again and when the numbers change and this and that it's going to go back to normal. It's just the way it is. You don't believe that. You strongly don't believe that.
Well, it may in fact go there, but it's going to take a very long time. It's not, people are trying to reopen. The other part is we know that mitigation works. It flattens the curve. It's pretty obvious. And then we have people carrying signs and doing what they're doing about opening up everything. The longevity of this thing is going to be exceeded because we have no immune system developed to handle this thing. And so it's going to continue until they figure something else out to be able to control the invasion rate of this virus. So I believe there'll be a second wave coming pretty soon.
Okay.
It seems that, people are on the beach.
So the beginning mind group, where they sign up and they're involved in 10, they go to your website, start there, they call you personally.
Yeah, it's interesting. We're working. I have enough that happens almost spontaneously. So, when you get the right thing, it just seems like lock and key. So I have two groups that just, right away just started. And then and there's only one of me.
Okay.
So I have to be careful about how I do things, just like you have to manage your resource, which is you. You have to figure out where the best place is. I think I can do 4 to 6 groups at this point, and I don't need to market them. I don't need to go. I mean, people who believe that the future is going to be different than the past, and what they have to do is invent their future, be innovative, and understand the things I'm asking them to do. That's what, first of all, that's what I love to do. And number two, I think, well, let's see if they work. I mean, we'll find out. This is an adventure. This is a discovery process.
Is this how you get your kicks these days? I mean, you thrive on helping guys become more effective, more successful.
Yes. There's something about that's what you and I have in common. There's something in the way you speak when you have a client or up on the stage with you, that you want to enhance their capacity to be successful. That drives you. That's why the Wellness Hour is so successful, actually. It's been around longer than The Apprentice. So I think that it's, there's something about contributing for me and participating with me. And now that I've got more wisdom about what I can do and see and say, I think it's important to contribute that. This is my tribe.
Okay.
I'm an elder. So I'm going to give to my tribe and see what they can do. When they come out on the other side, they're winning.
Good. I think if somebody watches this and they're scared about the future, so as negative as it could be that, hey, things aren't going to go back to normal, you're also very positive about the future of dentistry, as long as you adapt properly and change your approach. And I don't want to put words in your mouth.
No, I think you hit the nail on the head. I have another expression another principle. Breakdowns are the access to the future. I mean, if you're going to just do improvement, more, better, and slightly different of the same thing, you're going to get incremental change. But now we have a chance. You said the words clean slate. We have a clean slate to reinvent dental practice. It doesn't have to be the way it was before. If you have to reinvent a dental practice that has safety as its primary driver, what would it look like? Okay, let's get to work on that. That's where people should be working at this point.
So develop a reputation as a very safe office, one that's committed to cleanliness, etc.
Yes. I think that's a commercial.
So,
yes.
So final message. You knew you were going to do this interview with me. Is there anything we haven't talked about that you want to end with or bring up?
I usually end with an acknowledgement, and so it may be embarrassing for you to do that.
Okay.
But I really appreciate what you've created over there. You've made huge impact in people's lives, and I think that's a gift. And I think you have a rare gift to interview people that gets the best out of them. And having done a few interviews myself, I know that when I speak with you, there's an energy that I have, my chakras open, whatever you want to call that. So I just want to thank you for the opportunity to spend some time with you and talk about this. Yes, we could talk for days. In a month, if we ever talk again in a month, it will be different. I think things will just be different. I'll know more, they'll know more, it will change. So it's not about making the past better. It's about innovating a new future.
Good. You're part of our change with the Wellness Hour. Before, everybody had to get on a plane and fly to Carlsbad, California, and do the interview. And now we're doing Skype interviews, Zoom interviews, things like that. So everything is changing. And I guess those, I read somewhere, it's not the big companies that eat the small. It's the fast companies that eat the slow. And so you got to be fast right now to adopt to, doing these virtual consults, as you mentioned, to all of these little systems in place of developing and picking it up 10 notches, 10x, when it comes to cleanliness and when it comes to
Yeah,
getting that message out?
one of the things, so we're in chaos. Everything's moving and nothing's lining up. It's just everything's, skipping and skating and changing, and languages are changing. There's nothing. It's confusing. It's chaos. So I went and spent some time talking to people who are expert in chaos theory. And butterfly down in Brazil flaps their wings, and we get tornadoes up in Oklahoma. So chaos. And what the bottom line is that little things change big things. Little things change big things in chaos. So we can do things now because we are in chaos that end up as being very big things. That if we did them in the past, they wouldn't have the same impact. So I think what we're on to, it's going to change dentistry. We're going to change healthcare. It's going to be 10 years from now, it's not going to even look nearly what it looks like now.
Okay, good. All right. Well, I want to get involved in your beginning mind group. I think everyone needs a coach. It'd be nice to be a fly on the wall. I'm not a dentist to be able to listen to this. So
I'd like to have you. We'll record them.
Okay.
You'll be able.
All right.
I'll send you my tips.
I'd like to see that.
Okay.
So Dr. Marc Cooper, thank you for coming on the program, and we'll have to have you back.
Thank you for having me. It's always enjoyable to spend time with you. Thank you.
Thanks.